Hi, everybody. Welcome back. Ninda Luisi, Carly Francis. My name is Carly Francis. In today's episode, we're going to talk about the screening programs that are available in Nova Scotia. So, currently, there are three screening programs in Nova Scotia. There's a screening program for cervical cancer, there's a screening program for colon cancer, and a screening program for breast cancer. So in this video, I'm going to talk about the guidelines for each of the screening programs. So just before we go into the detail, I just want to let you know that these are guidelines. And guidelines for screening programs, sometimes they change. So sometimes the guideline that existed 10 years ago is not the same guideline exists today. And the reason being is that there's always research that's always being done, and healthcare team and scientists are always looking at the most recent data and the science, and then they base their decisions based on that. So the guidelines that I'm going to show you are guidelines that exist as of May 2020. So firstly, there's the cervical cancer screening, and you might have already heard about cervical cancer screening, and that's the pap test. And cervical cancer, it starts it from the cervix. So here's the cervix here, and the cervix is in the female reproductive system. It's part of the female reproductive system. And you might have already heard of a pap test or a pap smear. And what a doctor does is in a pap smear, they will just take a little swab of your cervix, and then that'll get sent for testing. And what the test will determine is if there's any cancerous cells or precancerous cells for cervical cancer. And when that results comes back, it'll either go to yourself or to your healthcare team, and then they will be able to follow up with you on that. So as of May 2020, the guidelines that exist is that so women who have been sexually active should start pap tests at the age of 25. So if you're sexually active, then you should start the pap tests at age 25. And those who have become sexually active for the first time at the age of 25, then they should start within that 3-year span of becoming sexually active. And currently, women who have not or are not sexually active do not need pap tests. And that's the current information. And this information that I'm showing now, it's available on a Nova Scotia Cancer website. So if you're gonna do the pap test, if you're a woman and if you're doing the pap test, if they come back normal, so normal meaning that the pap test came back and those cells came back clear, or your results came back negative, then women should continue every 3 years. So if you're 25, the next time you should go if everything is clear, you should go back when you're 28, and then every 3 years after that. So your results, everybody's results will be different because everybody's bodies are different. So your doctor will be able to talk to you about that, and they'll be able to follow up with you on that. So currently the guidelines say that screening could be discontinued, so it may be discontinued at age 70, but only in the case that there is negative screening history in the previous 10 years. And again, I'm going to say this for every screening that I'm going to talk about, that if you're not in this age range and you have concerns or symptoms for cervical cancer or anything regarding, that should be checked, then please talk to your doctor or your healthcare provider, and they're going to be the ones that are going to help you through next steps. The next screening program that's available is the colon cancer screening. Colon cancer screening, that starts in the colon. So the colon is here, and it's basically the large intestine in your abdomen. So what will happen is there's currently a test for colon cancer screening available right across the province. And this test is called the fecal immunochemical test. And this test is available for both women and men to detect if there's any precancerous cells or cancerous cells in a person's stool. So, and what that test will determine is if there needs to be further testing that needs to be done. So this is screening. So it's currently recommended for men and women from age 50 to 74, and how the program starts is all Nova Scotians on their 50th birthday are sent the test, and they'll get it in the mail. And this comes from the Nova Scotia Health Authority. And there's going to be instructions that are going to be in there on how you should do the test and how it should be sent back to the lab. So what you'll do is you'll do the test at home, and once you complete the test, they're going to send it off, and there's going to be the address, and the envelope will be all set to go. So what will happen is that'll get sent back to the lab, and then the lab will be able to determine if there's any precancerous or cancerous cells that should be concerned, and that will be sent to your doctor for follow-up. And then your doctor will be able to go through the steps of what the next steps would be. If everything is clear, if your results came back negative, then the screening is recommended every 2 years. So every 2 years after that, after your 50th birthday. So if you're born in even year, then you will receive your kit in even years. So if you're born 1950, you will receive your test like 2020. So the even years, like 1950, 1964, even number. If you're born in an odd year, then you will receive your kit in odd years. So if you're born, for example, with an odd number, so 1951, one is an odd number, you will receive your test in 2019. So that's how it works. And as long as you're registered with the healthcare system, as long as you have a Nova Scotia health card, you will receive this kit. And again, I just want to say that if you're not in this age range, but you have concerns or symptoms for colon cancer, please talk to your doctor or healthcare provider so that they can go and help you through that. Just one last thing, in the test, what it'll just be a tiny test tube, and you'll just take a tiny little swab of your stool, and that'll then that gets sent back into the that gets sent back to the lab, and that'll just help your doctor be able to help you with the next steps. All right, so the last screening program that they have available provincially is the breast cancer screening. And you might have heard mammogram. So that's the mammogram. Or you in your community, you might have heard that there's the mammogram bus that comes in your community. Some communities they have mammogram bus that park at their health centers, but some do not have that available. So depending on where you're from, just speak with your healthcare provider about this. So the guidelines as of May 2020, it's women who are age 40 are accepted into the program, and they're recommended for annual screening between 40 to 49. So if you're in that age range, then you would be asked to go every year in the screening program. If you are between the ages of 50 to 74, then you're recommended for screening every 2 years. So if you're 50 and if your results come back negative and clear, then you'll be asked to come back in 2 years. So if you're 50, then you'll go back when you're 52. And that's how the screening program works. And then women who are above the age of 75, they're recommended for annual screening. So every year if they are in good health. And what the mammogram does, it's here. What it'll do is it'll look at the female breast, and they'll look to do an X-ray, and that'll just to determine if there's anything that is not in the ordinary or something that doesn't look right based on those results. Then your doctor will be able to talk to you about that. A second note I should make is that breast cancer can happen in men as well. So it can happen in women and men. So just if you're a man and if you're concerned, just speak with your healthcare provider about this. Another important note that I want to make, these are guidelines and guidelines could change, but currently they're accepting women at age 40. But if you have any history or like history of breast cancer in your family, or if you're not in this age range and you have something that's of concern to you, then talk to your healthcare provider and your doctor, and they will be able to help you moving forward with that. Again, guidelines mean that they're not definite, meaning that women who are earlier than 40 can get a mammogram done. It's possible, but it all depends on your family history and things like that that your doctor will talk to you about. So that's it. Wala liyo tandil jiksaduyo. Thank you for listening to me. So in this video, I went through the 3 screening programs that are currently available right across the province. If you have any questions, please feel free to email me. My email will be posted below. And join me next week, and we will continuously talk about cancer. Wala liyo.